Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, life cycle of hydatid disease. So if you see life cycle of echinococcus granulosus, which is actually responsible for the hydatid disease. So in the echinococcus granulosus, the definitive host of echinococcus granulosus is actually the dog is the definitive host of echinococcus granulosus. So definitive host is dog, whereas the dog from the dog, okay, dog gives its feces, because whenever a dog is infected, dog feces contains up to thousands of eggs daily. They contain eggs are passed from the dog feces, and they are around thousands of ova are present daily. Okay, now when humans by feco-oral route, accidentally when the human ingests, okay, accidentally if the human ingests the ingestion of the ova, this will result in development of parasitic embryo will releases the oncosphere, okay, in the duodenum. Now this embryo of the uh, echinococcus granulosus, this will release the oncosphere in the human duodenum. Now what does this oncosphere do? This oncosphere, which is present in the duodenum, okay, this will now penetrate the mucosa of the duodenum, and thus it enters the blood stream, and from the blood stream it reaches the liver, where it develops into a larva, which will result in formation of hydatid cyst. So if this is the feco-oral route, it has reached first the duodenum. So first and foremost, it has reached the duodenum. In the duodenum, the ova will release an oncosphere, and this oncosphere will penetrate the mucosa, and from there it reaches the liver. Okay, from there it reached the liver. Now in the liver, it results in hydatid cyst. So if you were asked what is the most common organ involved in echinococcus granulosus, is liver is the most common organ involved in echinococcus granulosus, followed by lungs, spleen, kidney and brain. So liver is the most common organ, followed by lungs, spleen, kidney, liver, and bone is the least common. Then sheep, among this, if you see the host, sheep is the intermediate host of the echinococcus granulosus, whereas human is the dead end host, dead and accidental host. Then what about the definitive host? Obviously dog is the definitive host. Okay, actually, dog is the definitive host of Echinococcus granulosus, whereas the sheep is the intermediate host of Echinococcus granulosus, and human is the accidental dead end intermediate host of Echinococcus granulosus. Then, now from the hydatid cyst, there is development of the, okay. Now, if you see from the hydatid cyst, there is development of the scoliosis will develop into adult tapeworm in the definitive host, that is actually scoliosis will develop into adult tapeworm in the definitive host, that is dogs, and in humans actually the scoliosis will differentiate into hydatid cyst in the intermediate host, that is in sheep and in humans. Sheep and humans, we see that there is intermediate host. The hydatid cyst, new hydatid cyst is formed in the intermediate host. Now
thank you and thank you for watching.